So it gives me great pleasure now to move to our next speaker, Helen Thomas. Helen is Assistant Director of Leadership and Succession in Health Education and Improvement Wales. So thank you very much, Helen. I shall pass over to you. Hello.
Many thanks. Hi. Many thanks indeed, Ruth, and all of you for inviting me to this conference. So poor da pawb, and I'll just try and load up my presentation. So bear with me 1 second. So hopefully you can see the slides there. What I thought would be helpful this morning for this session is to talk about where we've been, where we are, and where we're going. We're a new organisation. We're just over 3 years old, and I think we've made some significant progress with regards to what we're doing on the leadership and succession planning agenda. And I'd like to share some of that with you this morning. So I thought perhaps it would be helpful to do it through the frames of our strategy for health and care in Wales. So what is our leadership strategy for health and care, and why does it matter? Why do we need to change the leadership capacity? Why do we need to change the way in which we train leaders and which leaders interact with people across the communities? I think I had a problem with the network there, so I'm just resharing my screen. And then I thought I'd move into what leadership offerings we have available through HEIW, and then a little focus on what leadership development is going on within the allied health professions and the healthcare science professions. And then maybe finish talking about Gwella, the leadership portal for Wales, and how that can help you plan your own leadership journey, whether that's synchronously or asynchronously, part of a network or part of a program. So those are the sort of themes I thought we'd bring into this morning's session. So I mentioned that we're a new organisation, but literally 2 years ago last month, we brought people together. It was just before COVID, and we had the ability to bring people together. And we had a conference inviting our workforce, inviting our stakeholders and Social Care Wales. And in this conference, we talked about, well, what was the strategy that we needed? If we are going to have integrated systems, if we are going to transform the way in which we deliver health and care services, what is the leadership that we need in order to do that? How do we create leaders with the capacity to ensure that their teams are effective, that they have psychological safety, that they are empowered, that they have autonomy, and they can continually deliver the best care they can? So we brought many people from across the UK, experts from Northern Ireland, Health and Care in Scotland, and NHS England, and we looked at what they were doing and used some of that information with the people that we had that day to map our journey. And I would just like to share you a 3-minute clip of the video that started our journey to create our strategy for health and care in Wales. Thank you, Rachel.
Leadership is everybody's business, and we've all got a responsibility for each other.
The purpose of today is to share the evidence, the best practice. It's to bring experience from other UK nations to take forward a collective leadership approach across Health and Social Care Wales.
It's great to see so many people here who've joined us today from a range of organisations spanning health and social care in Wales.
When you become a leader, and you are all leaders in this room, we are here to support patients and those who need to work through our system to achieve better care. We owe it to our NHS Wales staff and to the public to ensure that we work to develop compassionate leaders within the workforce so that compassion becomes ingrained in our services.
I'm working with Professor Michael West, who kindly spoke today. Really informative. Michael's very passionate about compassionate leadership.
It's about Interdependent leadership, leaders working together across boundaries, prioritising care for the people of the community overall. Reduce workload by developing multidisciplinary teams and developing roles within those teams so that we more effectively respond to demand. By managing demand, by looking at how we promote prevention and also how we work with our communities to help them take shared responsibility for our health service.
Leadership and culture is a huge theme that we've been exploring. I really think that it's going to be quite a priority area going forward in a wider programme of work that we're doing to support a profession under pressure. So I'm really excited to hear more about what different people in the room think about this and how it could be taken forward. And I'm really, really happy to see that it's part of Wales' strategy.
Everybody matters, everybody counts. And even though sometimes it feels like a very hierarchical approach, it's how do we make sure that this is about everybody who works and who wants to work in the NHS.
Thank you very much for taking the day out to be with us and to really help us shape what we've done today. So a round of applause to everybody in the room. Thank you very much.
It's such a pleasure to take time out of what is a horrendously busy job to talk about our people, our staff, our managers, our workforce, and to give some thought about how we actually help build a better NHS. And if we get this right, if we get our people right, if we get our staff experience right, as Michael has said, we will get our patient experience right. And that is what we're all here to do. It's all about the quality of the care that we give our patients. And to do that, we've got to care and look after our people.
Everybody comes to the same conclusion. People matter, and we want to do our best. It doesn't matter where you are in the system, Mrs. Jones and Di Bach are the most important.
Thank you for sharing that. I'll go back onto my sharing my screen again. So I think that short clippet of what we set out to do certainly says it a lot more articulate than I have. And you can see that we did start with a blank piece of paper almost, and we had that paper filling in throughout the day based on the experts, based on the speakers, based on the consultation. So we did really co-produce our strategy or co-design our strategy for health and care in Wales. And as well as that consultation exercise, we also consulted as part of our workforce strategy with our stakeholders, with the third sector, with the communities. And a lot of the feedback was coming back to say, well, what type of leadership culture do we need in the NHS so that we do treat our staff well? And we know there's a correlation between staff effectiveness and feeling valued and engaged and the outcome for patients. And that correlation really led us to look at the strategy that we needed to deploy. You can see the little word bubble there. And this is what was coming through from the consultation, that we wanted less elitism. Leadership is everyone's responsibility. It's not a hierarchical position only. They needed an all Wales approach. It would be so useless having one organisation approaching leadership one way and another organisation another. If we were going to work across boundaries, we needed a consistent approach with consistent leadership behaviours in order for us to address that transformation. We needed managers and leaders that were empathetic, that were emotionally intelligent, that were able to be agile, that will base their decisions on the value and the evidence that we produce. So a lot of richness came out of that conference and our consultation, and that informed the strategy that we subsequently took forward. So what were the other drivers then for a compassionate leadership approach? Well, even before the pandemic, there was significant evidence that health and care were facing a crisis. In England alone, there were 100,000 vacancies in NHS. We knew that there were high sickness absence across health and care in Wales as well as wider. We had high turnover and we had high stress levels and high levels of burnout. And of course, that would lead to damaging consequences for the health of our staff, for the performance of our staff, for the quality of care that we provided our patients, and sadly, in acute areas also, it adversely impacts mortality rates. And there's a significant amount of evidence showing that correlation between those high sickness absence and turnovers and stress and poor quality of care for the patient. And ironically, the people that were caring for others, i.e. our workforce, their health was being adversely impacted by the culture in which we work and the conditions in which we were asking these people to work in. So significant drivers for us changing our approach and our strategy and creating different leadership and different cultures across NHS Wales. So we followed the evidence, we undertook consultation, and we also followed the evidence. And you can see on this slide on the left-hand side, there's a couple of books there that I've referred to. The first green-looking publication was a publication taken by the King's Fund, the Faculty of Medical Health and Care, the Creative Centre for Leadership, all well-known leadership establishments. And also there were two universities in England. And they undertook a literature research around the leadership papers that have been written, the evidence that was available. And they distilled from hundreds of literature what was the conditions, what was the leadership, and what was the culture that would be the best and most appropriate for complex adaptive systems such as health and care. And they had some themes that come through that literature, and you'll not be surprised by some of these themes. Basically, we need a compelling vision and a strategic narrative. So we needed to know where we were going on things. We needed clear objectives. We needed really good people management and processes, learning, innovation, and space to reflect. We needed high staff engagement, and we needed effective teams. So yeah, that was a big piece of work undertaken. The evidence they produced or the themes that they produced are probably not a shock to anyone. Now we had the work of how do we knit all this together? How do we create that strategy and synthesize all of this? We also then worked with Professor West and took the last 20 years of evidence and the research there, and that was brought into our strategy. And then the second book there you can see is a book called Compassionomics, and that was written by Stephen Tresiak, and there's a great YouTube video which I'll pop into the chat later on, that talks about, is compassion the missing element of healthcare? And Stephen Tresiak, he's American, he's an intensivist, so a doctor, and also a researcher. And he started to talk about a finding that happened in the, I think it was in the 2007, in Sweden. Two buses collided and 5 lives were lost. But fantastically, there were more than, 65 people that were saved. There was carnage in the buses. And 5 years later, there was a research undertaken to talk to the survivors and ask them, what do you remember about that tragic crash? And there was 2 themes that emerged from that. One was the pain they suffered, but secondly, it was the lack of compassion given by the caregivers. And that led Stephen Tresiak to look at, well, is compassion the missing link, and does compassion count? And that led on to a number of research, and they're all available in this book, where I'm just going to share a few of the outcomes now with you. So the first bullet point, and I won't read them all, looks at a randomized controlled study where half of the anaesthetists in a particular area were told to have a compassionate interaction with the patient, and the other half were told nothing and carried on as they would. And you can see there, from when there was a compassionate interaction between the caregiver and the care receiver, from an anaesthetic perspective, there was a 50% lower requirement for opiates and a shorter post-surgery stay when compassionate conversations happened between those individuals. I'll pull out the second bullet point as well. And again, another randomized controlled trial, and we have the data, and we can give you all of the research around this. But patients randomly assigned compassionate palliative care survived 30% longer. So it led Stephen Tresiak, and indeed correlated with the research that said, if we are compassionate in our interactions, and if we have compassionate cultures and compassionate leaders, then the quality of care for patients is significantly enhanced. So we could not ignore that evidence. So lots of drivers for our approach to our compassionate and collective leadership strategy. Looking at the last bullet point there, then 5 nations collaborate. We also worked with the other nations in the UK, looked at their strategies, looked at their approach, and we all come together to agree that compassionate and collective leadership is the strategy we need for health and care across the UK. So we have the nations working together to create this new environment within the NHS and within the care sector. I'm just going to ask now for Rachel if she will just play another very short clip, because this clip is about what is compassionate leadership. And Michael West articulates this hugely more impactful than I certainly will. So thank you, Rachel.
I think the starting place is the core value of the NHS, which is compassion. It's the sense of really being present with the other and really seeking to understand their situation and wanting to help. And I believe that compassionate leadership subsumes collective leadership and inclusive leadership. If we're compassionate, we include everybody. We seek to involve everybody, to listen to everybody, to empathize with everybody, to help everybody. And when we lead compassionately, we're concerned to involve everybody, to share leadership, to work across leadership boundaries, to prioritize care overall, not just our areas. And collective, compassionate and inclusive leadership mean being authentic, and mean being open, having humility, being optimistic, being appreciative, and thereby supporting those we work with. Collective leadership in action is really about ensuring that everyone feels they have leadership responsibility in our health and care organisations, that they'll step in to do what's right, what they know to be the right thing. It's about shared leadership in teams where everyone again feels they can contribute and shape the work of the team. And it's about interdependent leadership, leaders working together across boundaries, prioritising care overall, not just our own individual areas of responsibility. And it's about a consistent approach to leadership, compassionate, authentic, appreciative, optimistic, honest and open in the way that we deal with those we lead. When you have compassionate, inclusive, collective leadership in teams, then you get great teamwork. Look, teamwork is about bringing together people with diverse knowledge and skills and experience and enabling them to contribute that in service of what we're trying to do in a healthcare team, in a finance team, in an HR team, in an executive team. And when you have leaders who listen, who understand, who empathize, and who help, then that ensures that everyone's able to contribute. Where you have teams that are not facilitated, led by compassionate leaders, but instead by directive leaders, what you see is that people are not able to contribute their knowledge and skills and experience in the same way. So those teams are less creative, less productive. They don't make good decisions. Where you have compassionate leaders, then you create conditions in teams that are cohesive, where there is a sense of support, where there's a sense of community. And in that kind of context, then you see we have the conditions for innovation and really good performance. So having compassionate team leadership is vital for the effectiveness of healthcare teams.
Thank you so much, Rachel, for sharing those 2 videos for me. Okay, so I wanted to spend some time there absolutely reflecting on why we've approached it this way and the criticalness of the fact that we need to change our leadership capacity, leadership styles, and create better environments for the staff. So summarising there, what is compassionate leadership? Well, it's an action. It's a verb. It's not a title. As Michael said, it's about shared leadership. Everyone is highly skilled within the NHS. We are skilled to do our jobs. Leadership should pass to those that are skilled to do it when that opportunity arises. It's also about evaluating inclusion and having diverse teams. We know that where there's diversity in boards, the organisations are far more effective. So we must evaluate equality and diversity and positively remove those barriers and boundaries where we see them. And it's also, as Michael said, about the effectiveness of the teams that feel empowered to make improvements. And critically, it's about promoting the health and well-being of our staff, so they are supported and engaged. So some drivers there for why we have approached our strategy in the way we have. So we've talked about compassionate leadership, but what do we mean by compassion? Well, there are 4 behaviours of compassion, and those behaviours are attending, understanding, empathising and helping. We've tried to present this as a compass, so it can act as our North Star when we are engaging with individuals or leading across boundaries or leading teams. And sometimes I reflect back on my compass at the end of the day and think, was I attending today? Did I really seek to understand what was going on? So what do these behaviours mean? Well, attending is what it says. It means paying attention to. It means being present with those that we are having conversations with or those we lead, and really listening for the art of joyful listening, or listening with fascination, as maybe Nancy Klein might say. And how many of us are guilty sometimes of listening and just waiting for somebody to pause so you can jump in, or listening and jumping in with what you think that solution could be. We're all very perhaps not as excelled at listening as we need to. So attending will lead us to listen with intent and listen without prejudice. But also, moving on to the understanding, being present enables us to listen to really understand what's being said, not presume we know what's going on. Walk in that person's shoes, check out what they say, and those coaching questions, let me understand this, tell me a little bit more, what that look like. So you really understand what that individual is saying. And by understanding and feeling those strains will allow you to go into empathy. And empathy then will allow you not to be overwhelmed by what's going on, which is more sympathy, but will give you that motivation to do something about it, which moves into the helping part. So compassionate leadership, the critical part of this, is not only being present, understand, but taking that 4th action, which is helping. And that will look different in different situations. Sometimes it's just a matter of listening. Sometimes you will, as a leader, need to help explore options and opportunities and take positive action. And there's a number of ways in which that can happen. But that is our compassionate behaviour compass, and those are the behaviours of compassionate leadership, or those are the behaviours of compassion. And these are the behaviours that we want all our staff across health and care in Wales to adopt and to embrace. In order to, embed this within our organisations and embed compassionate leadership, compassionate behaviours and compassionate cultures, we've released some principles that will help give us a route map for how we get there. On the right-hand side of the page, you can see our strategy for health and care in Wales is that by 2030, leaders in the health and care system will display collective and compassionate leadership. Michael mentioned just now in that video clip about a consistent approach to leadership. So our strategy covers health and care in Wales, a very ambitious strategy line there by 2030. But you can see we've got some strategic actions to help us get there. And those actions are our consistent approach, our accessible range of leadership resources, which I'll talk about in a moment, and our approach to talent management. On the left-hand side of the screen there, what you can see are the compassionate leadership principles. And these principles give us a little bit of a route map. So you can see there as compassionate leaders, gosh, I can't get my words out, in health and care, we will strengthen and respect voice. We will create these environments where collective leadership strives. We will improve equality, inclusion, and diversity. And what these do is give us a bit of a route map, but what we are going to do is create resource bundles that will help leaders and managers implement this in their areas of work. So we do create those collective and compassionate leadership cultures in the areas in which we lead. So what's occurring then in the allied health profession and the healthcare scientist leadership space? Well, in the allied health professions, in 2020, there was a pilot. It was the leadership practice placement opportunity for pre-registration students. We also have this year the first 2 allied health profession candidates in the Wales Clinical Leadership Fellowship programme. Previously, that has only been enabled for medical and dental staff, but that has been widened out for wider professions, and we are working to make sure that widens up even further for the 2022-23 cohort. AHPs have a Gwella Leadership Network, and on that network they've got 370 members. So the network on Gwella will give them access to resources and will give them nudges when leadership events or webinars or courses become available. And that's not just from HEIW. We link with the wider, with the King's Fund, we link with the local organisations, we link with the universities, so we promote all of the leadership. So when you have a network, you'll be alerted to all of these automatically. And the AHPs have also got programme priorities that have been agreed by the board recently, and they're starting to look at the succession planning process for allied health professions. What's occurring in the healthcare scientist space? In 2021, the PCEL leadership programme was completed, and 18 healthcare scientists participated in that programme, which was really well evaluated. Again, there's going to be a network set up on Gwella for healthcare scientists and a development of a leadership pathway, which is already in progress. A playlist of opportunities is also being undertaken, and that will be shared with you. So that will signpost you to lots of leadership resources and programmes that are going on. And there's currently scoping, as I mentioned, to widen the Wales Clinical Leadership Fellows to be more inclusive and be inclusive also of healthcare scientists. So we hope that that will progress this year, and we'll be able to widely advertise that for you next year. Other things that's going on that's been provided by HEIW, well, these are things that you can all, or the majority of you can access some of these already, and these will be available as well and notified on Gwella. So we've got the Introduction to Clinical Leadership programme, we've got the 3D programme, which is Discovering, Developing and Delivering in Healthcare, and that's a hybrid of how do you undertake a really good quality improvement project to make a difference to where you're working and create innovation, as well as creating the leadership capacity and leadership environments you need in order for that innovation to thrive and be sustainable. We've got the Compassionate Leadership in Practice. We've just piloted that with the fellows. That comes in with 20 credits at master's level. It's a 7-week programme, and we've just completed the 7th week, so we're now looking to evaluate that and make this wider. We support the Florence Nightingale Foundations. You've got the Wales Clinical Fellowship there. And then in December this year, or January, we are going to market the Advanced Clinical Leadership Programme, again, multi-professional. So you'll have the opportunity to have a look at what that entails and apply for that. So we'll be consulting on that a little bit more in the next few weeks, just to make sure we've got the format correct, and then we'll start to advertise. That will be advertised again on Gwella, and you'll be available to access. And as well as that, we've got a range of clinical networks, we've got alumni, and we've got loads of digital resources. So we have over 20 networks currently on Gwella, all looking at these resources and using the networks really effectively. With regards to succession planning, we've also put a number of things in. There's some grey ticks there and some blue ticks. So just quickly taking you through the majority of them. The blue ticks are what's been achieved. So we now have an aspiring leadership network, and comprises of 130 people. These are aspiring executives. And in that network, we provide them with a range of things. They've had masterclass series. They've participated in the work that we've done with the King's Fund, and has created a programme called Leading with Compassion, and that's our aspiring executive programme that we'll be running again next year. We've provided executive mentoring for these individuals. There's a range of Gwella resources, and we're currently looking at the diagnostics that we can put onto Gwella, and we've looked at the clinical leadership models we need. Coming online soon is going to be then the development centre, so we can customise the development needed to grow our aspiring talent. And we're also looking at Tier 3 development in the future year as well, in the next year from April. And that's looking at how do we feed, if you like, our executive networks. So what are we doing beneath at our assistant director levels, at our head of profession levels, etc. So we're bringing on solutions next year there. So a couple of things, quite a lot that we've achieved and a few things that we've got in progress. I won't go through this. This is just a route map. So it summarises some of the things I've already said, but we've still got some work to go to achieve what we need to by the end of March, and then an ambitious programme from April on. This is Gwella. I've spoken about Gwella quite a lot. It's not live, it's just a screenshot. And from that, what you can see is there's a number of things on there. My screen keeps disappearing, apologies for that. So on the right-hand side, we've got a few boxes there, and you can see that the resource box is where you would click to get all of your resources. Clicking on that will take you to a huge range of webinars, of tools, of podcasts, toolkits, frameworks, and resources really all around leadership. They're all credible and they link out to other organisations. We harness as much as we can. The portal is bilingual, so you can click on Cymraeg and that will move it to Welsh for you. Some articles that are not ours will only be in English, but everything we publish will also be in English and Welsh. You can see that we've got graduate programmes available, our talent and succession, that is being populated at the moment. And on the left-hand side of the screen, that is where we start to market our latest news. And it's a bit of a carousel. So everything that we publish, all the new materials, you'll be alerted to there. All the new programmes and courses, you'll also be alerted to. So if you can click on this, you don't need a password or anything, and access it freely. If you want to log in and have a password, then you will get alerted to everything that we do. So you can proactively design your own leadership journey. Just moving on to, I think, which is the last but one slide. The Gwella Leadership Portal, even though it went live only last year, has won already a number of awards. And you can see that we were gold winners last year. We won again last week with regards to the team. And we are speaking at the Excel Centre in London in February to share some of the work that's gone on. King's College London are keen to share some of the work that we're doing with Glyndŵr University, and also our work and the resources that we've got on Gwella are so credible that they are used by our colleagues in Ireland, Scotland and England, and only last week they were used in Melbourne for one of their national compassionate leadership conferences. So hopefully you'll find the quality in what we are producing quite high, and we strive to provide even higher quality. And I would just like to finalise or close really on the work that we've been doing with Michael West. We've followed the evidence, we've used credibility and credible experts in everything that we've done. We were delighted this year to help Michael publish this new book called Compassionate Leadership, catchy little title called Sustaining Wisdom, Humanity and Presence in Health and Social Care. But this book has a number of chapters that take you through the journey of compassionate leadership. It's filled with resources, ideas, YouTubes and questionnaires and loads of resources really that can help you really understand what we mean by compassionate leadership and become a compassionate leader. What we are doing over the next few months is working with our colleagues across health and care, and we're going to take each of these chapters and digitize them. So again, these materials will be available in nice chunks for you on the Gwella site. We've also got a couple of books that we can give away to people that might be interested in receiving a copy of this book. So the first, or random 5 that we pick out, I'll give you an email later on. You can drop me a line if you'd like one of these books, and the first 5 or the random 5 we pick out can have a copy of this book. I'd just like to finish by saying how delighted we are to be recognised as credible enough to share some of the work we're doing in this book with Michael, and for Michael having the confidence in us to help him publish this book, which is dedicated to all those health and social care staff working during the global pandemic with their courage, commitment, compassion, and to all among them who give their lives in caring for others. I think that is a really apt note to finish on, and also reinforces why we need to change our culture and support the staff that work within our system so we can continue to give the care to the communities that absolutely rely on us. Thank you so much.
Oh, thank you so much, Helen. That was fascinating, excellent. As you see, lots of virtual applause. We do all miss, don't we, sitting in a room being able to cheer. So thank you very much. And I know you're joining at 11:20 for the panel.